What the HealthTech listeners, I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice across health and social care. Today I'm thrilled to have Michael Wyrley-Birch, Chief Strategy Officer and co-founder of Cassette Group, joining us. Cassette Group is a leading immersive technology solutions company working with healthcare organisations like Pfizer, Baxter and Takeda. Mike brings a wealth of knowledge about how innovative technologies can transform healthcare, especially in training and development. So I'm absolutely thrilled to welcome him to the podcast today. Welcome, Mike.
Good morning, Justine. It's so good to be here and to be talking to you about this interesting subject, which I'm obviously naturally very passionate about. So.
That's what we like from our guests. So I think the best place to start is maybe telling us a little bit more about why immersive technology is so important for training, learning and development in healthcare, and maybe a little bit about Cassette Group.
Oh, perfect. I think we should start always with the sort of the why. And, when you look at, we're surrounded by innovation every part of our lives, the fact that we're talking like this today, the way we travel, every component. But in training and learning, it's still very much sort of reliant on one expert imparting their knowledge to many. And, we see immersive technology being able to really help enhance the way we learn and innovate in that space. Because, while that style of learning for the last 100 years works for, a large number of people, we find learning by doing actually is more powerful. So there's a lot of research that sort of shows that if you do something, you retain the knowledge, 75% of the knowledge, whereas if you just listen to somebody, you only retain 5%. And the example I'd give is, the last time you caught a plane, how many times do you look at your seat number? And that's the most important bit of information you need in the next 20 minutes, and it's usually a really simple number. Yet you look on average 3 to 5 times. And that's because we only retain about 10% of what we read. Whereas when you actually do something, if you built a piece of IKEA furniture, a year later, you can remember it. And what immersive technology now enables us to do is to actually do simulated learning, do virtual simulation. And you'll take the airline industry and healthcare sector have always really valued simulation, but it's really expensive to build physical simulation centers. Whereas immersive technology now allows us to build virtual simulation that's accessible anywhere and anytime. And that's very much what Cassette's all about.
I think you're right. It's such an interesting topic in terms of learn by doing. I remember even when I used to be at school and, revising for exams, for example, I was terrible at remembering stuff if I'd just tried to read it through. And I literally had to write out notes constantly for it then to be basically retained for an exam. So I think it's, that's a good few years ago now, but I think it's, that sort of way of learning by doing, I think is quite a key thing for people now.
Absolutely. There's a lovely bit of research where they took a straight piece of text learning and they quizzed people on it. And then they took the sample group and actually put it onto an interactive website. So where you essentially had to click things, you had to actively engage. And when they redid the quiz, they had a 16% uplift in results. But actually, more importantly, the bottom quartile, so the bottom 25% of people improved by 64%. And that just shows that, the straight text-based learning doesn't serve, a large part, number of people. And actually, by being able to learn in a different way and in a more interactive way, they can improve their comprehension.
Yeah, I think it's really interesting in healthcare as well. So what do you think sort of makes technology and training quite underutilised in this sector as it stands at the moment?
I think it's with any innovation, we suffer a little bit from the Gartner hype curve. And I don't know if you're sort of familiar with that, but it's that when a new innovation comes out, there's a massive hype and a promise. We're in that right now with AI. And then what the hype curve does is after the initial hype, there's always a drop into the trough of disillusionment where it doesn't quite meet the promise. And a lot of people, when they hear the word immersive training and immersive technology, they think about it as VR headsets and physical things they're going to put on their face. And while they're fantastic, the early models were quite sort of, the graphics weren't great. They could make you motion sickness and expensive, and the content wasn't available. So I think people immediately think of immersive technology like that, whereas now you've got interactive websites and things you could just literally access, tools you could access on your mobile phone or on a laptop, and then literally have an immersive and interactive experience. The headsets have also got considerably cheaper and much better quality now.
Yeah, that's a really key point. I know I've seen quite a lot of people, getting the VR headsets as sort of presents and things like that as well. So I think that cost element is definitely obviously a key thing within healthcare. I think in terms of, professionals facing challenges, so we know staff shortages, financial pressures, burnout, they're all sort of key things that come up across healthcare quite a lot. So do you think immersive technologies can address these issues and help to free up that time for patient care and support staff well-being, I guess, importantly as well?
Absolutely. And I think it's one of those things that it is just one of the strings in the bow that could be added and an additional tool. Because, if you look at the NHS work plan, what they're forecasting by 2030, the huge staff shortages, there's a large amount of training being needed. But also as we get to people living longer, because healthcare is doing a great job, it means that there's great complexity at the end of people's lives and what their needs are. And there's needs to be training on that and new drugs and new techniques, etc. So immersive technology can certainly help with that. But where it importantly helps individual healthcare professionals is, there's so many stories now where they can't actually access the training because they're just too busy. And they're now getting home exhausted and needing to do it in the evening, which means they can't access a simulation center if it's at home in the evening. And the last thing you want to do is suddenly be faced with a 64-page, highly intense document when you're exhausted. So if there's something that you can do where you can access at any time, it can allow you to consume the same content 4 times faster, but also it allows you to pick it up and to drop it off, so you can do 10 minutes here, then put it down for a while, then do another 10 minutes. This is where immersive technology can really help.
That picking it up and like the 10 minutes thing, I think is pretty key because, like you said, you get home, you're exhausted, you probably are looking after the kids, so sorting dinner out, that kind of thing. So I guess being able to do it in and amongst sort of then your that work-life balance a little bit is really important. And then there's a bit of a fun element, isn't there, then, with, how can we kind of link the fun and the training to then make it an enjoyable thing to do as opposed to, I've got to do this training course and it becomes a bit laborious. You kind of can bring that, get people to enjoy doing it, which, I'm guessing would help retain that information even more.
Absolutely. And there are kind of two parts to it. If I should answer the picking it up and dropping off first and then the engagement is, for example, for Baxter, they make the Prismax dialysis machine. And there the challenge was that the trainer would go into the hospital and the hospital would need to schedule, 10 healthcare professionals off the front line to then be standing around a dialysis machine now that wasn't active and be trained on it. Whereas we were able to make a digital twin of the Prismax 2 so that behaved exactly like the real machine. In fact, we had one which we called Diane in the office with us for 6 months while we were developing it and creating all these modules. And essentially now this allowed someone to be at home on their laptop to access a training module, go in and actually learn where you plug this in, what you need to do, how you need to set up the screen, do the various actions. This is all linked to the learning management system, so it's tracking what they're doing, what their progress. They then could get on the bus, pick that up on their mobile phone and carry on doing it, and then get into the hospital and where there's a VR headset and they could put in the VR headset, but in the clinical environment, they can look around and then they can continue their training. And then these are all broken down into individual modules. So, I can do module 1, then module 2. And this was very easy also then to translate into 10 different languages so we could send it out globally. But that's when you talked about that work-life balance, is imagine then being able to not suddenly know, I've got to do 1 hour of training. Where do I find that hour? You can just break it down into those little segments and you can see how it fits in. But then the most important thing is to make it engaging. And we've, for example, developed a tool called, the engagement model, which is essentially taking game mechanics. So these are all the types of techniques that are used in a game where games say, you have a very accessible convention, you know what the game immediately is. You've got different levels and targets you need to achieve, and then you get a reward at the end of that. So we use those game mechanics, but then we also take storytelling techniques. And in storytelling, it's the same thing, how each chapter reveals, keeps you hooked in and has a narrative. So then if you make suddenly the training have a relevant story and a relevant need, and suddenly give names to the components and the people and the patient, the virtual patients, it suddenly makes it far more interesting and engaging. And then finally, we use learning theory. So by combining the three, we can then make things that you clearly understand immediately as soon as you start the training exactly what the task is. It's fun because you suddenly gain through episodes and you meeting challenges and their little cookies and rewards for achieving that. And even though you're doing a really serious subject, there's no reason why you can't make it still engaging, just like we get sucked into a story in a Netflix series and suddenly can't sleep because we've spent the whole night watching 8 episodes, as I do. And that's what we're trying to do. So it doesn't feel like hard work. It doesn't feel like I'm exhausted after doing an hour of training. Actually, at the end of it, I feel really I've achieved something, satisfied. And then most importantly, because this all tracks back, the actual trainers can see exactly your progress, where you need support, so that you can give that individual most relevant support rather than trying to talk to a whole group of people. So it's not to replace the trainer, it's an active tool to just help them.
Yeah, and I think that's really exciting. That I love the idea of it being that story element there, and being able to sort of follow that through, and characters having names. And I guess that goes back to at the beginning, when we're talking about retaining information and kind of finding something interesting that then helps you to then retain that. So not only is it more engaging as an element to do that training anyway, you're going to retain it a lot better than you would if you were having to read like that 64-page document or something like that.
Precisely that, because you get in the visual stimulus as well, you then act, and then you actually physically doing things, so you're building the muscle memory. And because any of the training, and not all of it's with a digital twin, it might be just doing an interaction with a website, but it's prompting you to what do you do next. And we find that actually you learn most by failure. It's the mistakes that you make so suddenly you click on the wrong thing or the wrong element, and then there's an action or a reaction. That's what actually triggers you to remember, oh yeah, no, don't push there because actually I need to press here. Whereas when you just watch a video of somebody doing it, they're doing it correctly. And you go, oh, that's easy. And then a day later, you look at it. If you've ever been on a computer and you need to try and find how to do something and someone shows you, or you watch a YouTube clip, you think, oh, that's easy. Go back a day later, you don't remember. Whereas it's when you fiddled around and you had to explore and make mistakes is when you make your those pathways and connections get made in your brain and you retain the knowledge.
Yeah, I mean, that is 100% right. The amount of times I've had somebody sort of show me how to do something and then you're like, yeah, that's fine. I know how to do that. And then exactly like you just said, 24 hours later, which button was it again?
Exactly. And this idea that we all stand around together doing training at the same time, the trainer has to pitch it at a level that means that by definition, 50% of the room is going too fast for, another 50% is going too slow for. And people have different learning styles and different ways of sort of understanding. So to be able to have training that is unique to you and go at your pace, and you can do so that when you then meet with the trainer, they can give you the individual attention that you need because they've been able to see by tracking how you've done and how you performed. But also where your blind spot is there because it's been highlighted to you. You go, I need help here.
And again, I think that comes back, that helps with that feeling that you're doing it, you're retaining stuff, you're doing it at the pace you need to do it at. You sort of you're thinking just about the training as opposed to thinking about, oh, actually, what did the trainer just say? I feel a bit more behind, or, I'm a bit bored because it's not going fast enough, or whatever that might be. It probably stops your mind from wandering as well, which then it keeps it focused on the actual task of the training itself.
Absolutely. And in this engagement model, the third step in it, and there's a whole lot of elements to that, is about reward and achievement. And what we found with immersive technology, there's a huge uplift in confidence because people have physically done it. They've tested themselves. They can go back. They can redo. They've made mistakes, learn from those mistakes. But also because we're giving them positive reinforcement when they do something correctly. There's a little Easter egg or a little cookie. The one that makes me smile, if you use Waze when you report that there's a heavy traffic or whatever, it always pings up with a few points. I've got no idea what those points do, but we all do it. We go, "Ooh, got some extra points," and it's we need that positive reinforcement. And so while we don't make anything gimmicky, what we do is certainly have techniques so that you feel as you're going along, great, I'm getting this right. Doing well. It's not as if it's all based on a test at the end that goes, da-da, you failed. It's actually the whole way through. And I think one of the key things is we make it episodic so that it's not just this 1 hour chunk. And a lot of CPD training, is the points are collected based on a time base. So you're always sort of faced with this, I've got to do 1 hour. And it's actually quite difficult to carve out an hour a day. Whereas if you can carve out those 5-10 minutes that build up to an hour, that's all tracked. That feels episodic. You then start looking forward to it.
And that's it as well. I think when there are training courses where, like you said, it says it's going to take you an hour to finish or an hour and a half. A lot of the time you can't start and stop it. So if you sort of do it for 10 minutes and then break off to do something, and you could potentially lose that 10 minutes anyway and have to start again, which is even more frustrating when you're doing something like that.
Precisely. And a lot of them also, it's, when you do training's quite fragmented, where when you do each course, it's up to you as a healthcare professional to keep a record of that. And so you've got all these certificates all over the place that you've got to keep a record of. You've got to, when you start doing it through technology, you'll have a digital version in the cloud that can just follow you, and you can access at any time to be able to show and demonstrate what you've done. And as this becomes more common, everybody will then just have their own sort of digital passport of what training they've done.
And that's really important for self-development, isn't it? I know a lot of people sometimes think, oh, training, I've got to do it. It's, it's compliance, it's everything else, which of course it is. But there's another element of it that should be seen as it's self-development. It's helping you as an individual. It's, whether that means you want to kind of improve in the role you're in, or whether you're looking to move into a new role or something like that. Having that kind of background of that, that tracking of any kind of training and things like that you've done has got to help with that sort of that development of you yourself as well.
Absolutely. Your personal development and recognition, that's critical, but also making your job easier. We talked about a moment ago that, people are burnout, huge stress. And one of the things I sort of feel at the moment is when people are so busy, it's quite difficult to sit back and think for a minute, how do I make my life easier? Because it's just, I haven't got time to make my life easier. But that's where if we can make tools that are super easy to access, right there for them, that then can suddenly help you and just hold your hand through it. And, a lot of it, the first time you do it, it's foreign or we haven't done it. But a lot of these technologies now, because it's developed so much, they're now intuitive. You don't need to have an instruction up front on how to do it, and you can then just dip in and immediately get it.
Yeah, and I think as well with, like you said, with all the technology and stuff that is available, I think it's also about picking the right tools for the right things that you're doing. So I know we very briefly touched on AI a little bit, but there's that many AI tools around productivity and things like that now that it can almost become overwhelming. So I think there's an element of looking at what you need the tools for and then making sure that you pick the right tools for what you're actually doing, whether it's training or productivity or whatever that might be as well.
You're absolutely right. And it's very easy for us to have a binary, oh, this doesn't work. These immersive technologies work incredibly well for certain things and not for others. It's not there to replace the human touch, the human interaction. Instead, what it's to do is to just give you the time then to focus more on the human element. And for example, in AI, there's so many out there. I mean, we've developed an AI patient where you can have conversations with it and practice your bedside manner and talking to it. It's not there to suddenly take away the human element of it, but it's instead of where the normal training is done, where you have an actor coming in and you do role play, which is always awkward when you've got a room full of people watching you, enjoys role play when you're doing that. But for you to be able to rehearse with an AI character and have a chat with it and talk, and it gives you feedback on how do you keep the conversation being empathetic, listening, but down to 10 minutes. So that it's not, you can control your time, which you need to do, when having conversations with patients. It's there just as a tool to help you build those techniques and those things. It's not there to replace the human element. And AI, I think, we've just got to remember that what you've seen with AI at the moment is as bad as it'll ever be. It's only going to get better. And there's so many AI tools out there at the moment. I think it's, people just need to give it a little bit of time. It's developing. It's going to grow incredibly fast. And, my prediction at the moment is that it's a bit like the Gartner hype curve I mentioned. The initial hype is up here. We are going to go through a bit of trough of disillusionment where people go and say, oh, well, it's making mistakes, it's hallucinating. It's not as like, absolutely. So be very careful what you use AI for right now, because it does hallucinate. But as we all learn how to train it and lock it down, and it's growing exponentially, it will become an incredibly powerful tool for helping you to review complex documents really quickly. Most of the work we're doing right now is actually training people how to assess and use AI, less about actually building the AI tools. Because one of the challenges people, no one trains us on how to use AI. It's a bit like if someone arrived in your kitchen and gave you this new, massively complex Magimix that does everything and just said, here, use it. If you didn't get instructions on it, you wouldn't know what to do and where to start. And that's what AI is. It's actually quite a complex tool. It's not just for improving our grammar or doing funny pictures.
Yeah, I think I went to a conference in end of last year, and there was a chat about AI and things like that. And the guy who was running it was talking about how actually it's such an amazing tool, but you have to put the time into training it. You almost need to treat it a bit like an intern, depending on what you're using it for and things like that. And I thought that was really interesting, because you can't just go into it and pick it up straight away. You do have to put that time in, and it's not a magic tool that's going to fix absolutely everything. But if used right and you've spent the time on looking at it properly, then you can definitely get that to help you with that productivity, that efficiency, the training. It could be such an amazing tool to kind of take some of that day-to-day stuff away a little bit.
It's precisely that. So the way I sort of often think of AI as the same as a knife. A knife can be dangerous, and in the wrong hands can do real harm. But it also could be the scalpel that saves your life, or peeled vegetables that nourish you. So it's just how you use it, and it's taking that time to train it, to use it in the right user cases. So in some cases in healthcare, it could be just to take away some of the administrative load and the admin load of report writing, of emails, etc. There, that then is taken away, releasing some time for you to then be getting back to what your first priority, which is patient care. And that's why I think we have an open mind to it. What I'd encourage people with AI is embrace it, watch it, but then understand it, because when you understand it, then you can say, right, this is when it's appropriate, this is when it's not appropriate. And the final one I'd say is also, the one we encourage the clients is often people see, because of the nature of AI, it's there to make things really fast. But to make something really fast, you take any elite athlete, they put hours and hours of training in order to be that efficient and have that high performance. That's exactly what AI is. You've got to put in upfront work in training it on anonymous data, on the right data, so there's no data biases in it. And in healthcare, that's important, because a lot of the data sets, we've got to make sure that we're very, very careful that we're protecting individual patient data.
Yeah, definitely. I mean, touching on patients, there's definitely a benefit, isn't there, to kind of what these immersive technologies can bring to patients, and the training side and things like that. Because I guess the more that we can release time for professionals to then spend time with improving care, the quality of care offered, the kind of the reassurance side, then those tools are there to kind of help actually not necessarily bring back the human element, but people are worried that technology takes away the human element, whereas actually these tools are there to actually improve the human element, because there's benefits then to patients by the increased time that people can spend with them.
Precisely that. It's not a binary decision. It's not that the robots are going to take over. It's just that if an AI tool can help you to do the heavy lifting quicker, And that could be either administrative or even in some sort of diagnosis elements. If it can help do that, then that immediately frees up more time for patient care. So
yeah, I think it's a really interesting point, that I think, and it's the bringing it back to the human element, I think, is the bit that's particularly key for me.
Yeah, and that's the one thing. It's I think in this technology world is just reminding ourselves that they're there to aid, not replace. AI is not going to suddenly take over the world. It relies on power. You can always pull the plug out. It's one of those things. It's there to help and serve us, not to replace us.
Yeah. We touched on, you very, very briefly there touched on sort of, kind of making sure like data's not biased and things like that with it. And I think there's definitely a role there that immersive technology can play in promoting accessibility and inclusion. So, for example, supporting staff with colourblindness, dyslexia, or enhancing patient care for those with sort of neurodiverse needs. What do you think? How do you think that can the immersive tech can help with promoting the accessibility around some of those kind of elements?
Absolutely, and this is where one of the number one benefits are. When you look at a lot of the training materials, you look at the Marsden Handbook for nursing, it's in a tiny font, all full print. It's, so if you someone with dyslexia, that makes it incredibly difficult to access. Whereas the majority of immersive technology is visual-based and high-fidelity visual-based. And therefore you're able to learn by actually physically seeing inside the body, seeing inside how a cell works, how the structure, rather than reading how it's explained. So specifically for dyslexia, but then you take colorblindness, it means that we can actually, when we produce it, we test both, the colorways for colorblind to make sure it's accessible. We also look at the fonts that are used and when they're used to make sure that they, it's accessible. And for neurodiversity learning, it's actually how I got into this. And, my youngest son is autistic, and he's at a specific school where, he is a visual-based learner. And you can see as soon as you change the training material, his ability is incredible. And all it is, you just need to change the way that you actually learn and the materials that you give. And that's what immersive technology allows us to do it. So you can make it that someone can navigate a space intuitively, understand it, physically see it. And where you previously maybe had to read something, it could just be a voice recording or a video play or another medium that just allows it to be more accessible.
Yeah, I think that they're things that, like you said, years ago, they weren't necessarily thinking about that kind of inclusion, I think, or that accessibility around, like you said, these hundreds of pages of documents and reading it and kind of it actually being retained as well. So I think there's a really good opportunity there when it comes to immersive technology and being able to kind of train and help retain it.
Absolutely. Training and education, I think, we're talking mostly about healthcare professionals, but if we think about patients and the difficulty and the time spent explaining to a patient what, either their complex need or the concerns, Google can create incredible anxiety if you've just been given a potential diagnosis that, you need to go for further testing on this because a red flag's been raised on. The biggest risk is you go into Google and it just comes up with, the most terrifying things. Whereas if a healthcare professional is able to go and say, go to the site, and therefore to be explained in very clear, in immersive, where you've got visual aids, you're going to go for a scan and the machine's going to make certain sounds, instead of explaining, when you actually can see an animation of exactly what's going to happen to you, what the sound the machine's going to make, it can take away all those anxieties and you now know what to expect. And especially for people, neurodiversity, a lot of it's about managing the change and the transformation so they know what to expect. It's not a surprise. And I think a huge amount of time could be saved for healthcare professionals needing to explain some of these, but also having patients that are far better prepared when they come to them. So I actually think the biggest progression for immersive technology will be in patient education, as much as it is as healthcare professional training. so we can move on from having a plastic model of a knee joint to show what's going to happen, to actually be able to send someone away and go to this link. You can now explore it, you can manipulate it, you can see what's happening, you can see how the patellas, how that's worn. It can show you over a period of time how it's going. And, we've done that very specific project for one client where it's literally shown the internal bleeding and the hemorrhaging over a 9-month period. You can really see what's happening.
That's amazing. Like you just said, Dr. Google is the worst thing you could ever do whenever anything's wrong. And everybody knows that, but everybody still does it. So I think to have that education side and to help with, a lot of people are they've got real phobias of kind of hospitals and, particularly maybe getting a procedure done or something like that. So even to help with that kind of thing as well, that again sort of probably will save a lot of time. It will help kind of educate and for that patient to understand exactly what is going to happen or what is involved with a particular procedure, or, if they've got to go into hospital a few times, then what exactly is going to happen each time. So I think that's a really exciting development, I think.
Absolutely. And the areas that, go to every element of, your healthcare. So, for example, I was looking, we're talking to someone in the US. We do a lot of our work in the US. And it's an enormous hospital, like absolutely enormous. And one of the biggest issues they had is the amount of time that clinicians were spent, or healthcare professionals were spent, doing wayfinding, basically giving directions to patients and showing them where to go. And actually to just have the equivalent of Waze or a navigation that you have in your car for getting around the hospital, so that when you get to your appointment, you're going to this department, this is the time of your appointment. Imagine if you just got a link to your phone, SMS to your phone, that you just clicked on and it just goes, and it just picked up, you are here, this is where you need to go, turn left, turn right, etc. Now, we know that won't work for all patients, and especially, for a lot of elderly patients, but, you take over the next few years with generations that are absolutely native to using these technologies, that would, save so much time in the hospital, not needing to give someone directions.
Yeah, and I think that's something you don't even think about, do you? But if you're getting asked direction questions, hundreds of times a day or something like that, that is a lot of time spent.
Precisely. And you know that the person is worried because that's why they're there for that appointment. So you can't be curt and just go to the end of the corridor and turn right. Sometimes, and because, people want to, rightly give the care and the right thing. Actually, that's not often a 30-second conversation. That's certainly a 3-minute, 5-minute conversation.
Yeah. I think it's an incredible development, that I think. And like you said earlier, these things are only going to get better and better, which I think is an exciting thing for patients and for healthcare professionals. And it brings me on quite nicely actually to the next bit I wanted to chat about around, we have had a bit of a budget boost in the NHS recently. What do you see as the biggest opportunities to improve healthcare training and technology?
I think the biggest opportunities actually to try and for the technologies to be able to save costs, to release even more money to go to the front line, to go to staff salaries, to go to. So it's not about immersive technologies trying to take a grab of what that investment is. But I think where one of the opportunities is currently a lot of the money is spent individually in each hospital. And that's correct because they've each got their specific needs, etc. But when it comes to training, if one was able to have NHS Trust combining together and actually developing technology solutions that they actually own the IP that's linked into, that's highly relevant to them, then that's when they could see the savings. For example, like the wayfinding. But even though hospitals are designed differently, they all have similar components. So when you start putting 3 or 4 different trusts together and say, look, we can do 4 different solutions for you that are bespoke to you, but actually there's a commonality here of, a whole lot of the environments that we can just cookie cut from one to the other. So I think there's, huge opportunity with that additional focus on the NHS. But I see it as really a way of how the technology can help, as I say, release more funds for frontline services.
So we've talked a lot about kind of there's so many benefits involved in immersive technologies, especially when it comes to training. And I imagine, if there's a lot of people listening to this, that, where do they start? What do they do? If there's sort of like organizations or healthcare professionals listening to this thinking, what do we do? How do we kind of move forward with it? What's your advice for what they should look out for? And especially if they're concerned about maybe like costs around implementing or, just kind of getting it implemented properly or anything like that. What advice would you give for anybody listening?
Cheekily, I'm going to say call us. I think I would say first thing is just get started. Start small, but don't do it on your own. Do reach out to other NHS trusts, look who else is doing it and try and collaborate with others. Because when you're trying to do it on your budget on your own, it's too expensive. It's too big a hill to climb. But when you suddenly get 3 or 4 different trusts, as I said a moment ago, working together, ideally to me, it would be every trust working together where actually it's just a central team producing it. Because at the moment, what I think a lot of people have looked at doing is buying off-the-shelf solutions, but each time they put off because they say, it's not just quite right for us. And then there's the concern of, well, off-the-shelf, there are some very good off-the-shelf solutions, but then integrating it into their systems, what happens at the company, how long are you tied in, what maintenance support, etc. Whereas actually don't be frightened to build your own by working with a number of different trusts and say, right, what is the biggest need we've got? And start small, just get doing something and then learn from that, and then you can build out. There's a quote that gets sort of attributed to various technology experts from Bill Gates to Steve Jobs, which is, everybody massively overestimates what they can achieve in 1 year, but underestimates what they can achieve in 5 years. And that's why I think it is this point of don't be scared to start small. Create one thing, get people then onto it, using that. And then you'll find in 5 years' time, you've actually developed quite a lot. It's when you try and boil the ocean on day one that you just hit barriers and it doesn't work.
I think that's a really key piece of advice. It's, it's something that we hear a lot about in terms of, there's no magic tool that can fix absolutely everything. So almost what do you want to do with it? Look at kind of the objective and look at what that piece of software or training or whatever it might be that you're looking at can fix. But also, like you said, think about the future in terms of, does it integrate with things? Does it talk to other bits and pieces? Does it, would it work for other locations within the trust rather than just one specific area? So I think you're completely right. It's starting small, but thinking about the long term whilst you're starting to implement some of these pieces.
Absolutely. I'd give an example of one that, right now there are a lot of trusts looking at how they could use AI tools. So, for example, we've actually done this for somebody, is create an AI training tool. And it's actually a game. And it's based on, I can't give the details of it, but essentially you've got set challenges and you have to solve the challenges and these puzzles using different AI tools. And essentially shows people how they can use an AI tool to suddenly read a 64-page document and find the answer very quickly for them, or how to do sort of various things. Now, something like that is immediately not putting any patient data at risk. It's not putting any care at risk. It's not interfering. But what it is doing is immediately allowing your staff to learn how to use AI, for example. And that's what I mean about starting small, by doing something that you kind of go, is an immediate need. We need to train people on how to use some AI tools. Let's decide to use the tools that we use. So, for example, the one that we've done for this one particular client, it's on your login, so you don't have to go and visit a third-party site. It uses the AI tools and logins they already have. And the case studies are all very relevant to them. And immediately from there, they've now gone and said, right now we want chapter 2, 3, 4, 5. And then it suddenly meant that people started embracing the technology and not being scared of it suddenly again. And that's just one example of how one could do something.
And that's a great example, because I think sometimes people are a little bit afraid of some of these new things. They're not quite sure how they're going to work. They're sort of a bit skeptical of them as well. So I think having something like that where you can go in and grow your confidence in in how that could work before you start implementing and using it in your real day-to-day is super important.
Absolutely.
So in terms of immersive technology, we've talked about how much things have evolved over the last sort of 5 years or so. What do you think, how do you envisage can't even speak now. How do you envisage this evolving in healthcare training over the next 5 to 10 years?
I think, the biggest thing is going to start at the need, that we've got so many people that need to be trained. And I mentioned earlier the healthcare plan, the NHS people plan. And, they talk about by 2030, over 100,000 nurses that need to be training. So I think that's where immersive technology will be helping to aid that, to train so many people. But also, as we see, you start talking about the next 10 years, how many the workforce will actually be Gen Z, and people where this type of learning is native to them. But then finally, I think it'll be the acceleration of the innovation and AI and the technology. It is going to grow exponentially each year. So that's where it will naturally fall in. It's definitely not a binary, it's traditional way of this. It's just an added tool to where appropriate, for the right type of training, to make it just far more accessible for people, far quicker, a way to track easily, a way to retain better knowledge, so that then you've got more time, as I said, for patient care, but also for the other types of training. So, the immersive technology, I think the main thing I would say about it, though, is often when people have talked about immersive technology, they've thought about it as something for the future. It's not for now. 5-10 years ago, that was correct. Whereas actually right now it's being used actively by our clients that I've mentioned, Pfizer, or you mentioned at the beginning, Pfizer, Takeda, Sony. They're using it actively. And in the US, it's being used by, a large number of hospitals. It's right out there. It's being, very heavily used as a training tool. So it's no longer this sort of mythical thing of the future, or I'll wait and see. It's actually very much for the now.
I think it's really exciting. I think it's a really nice way to end, that it is for the now and it is being used. And I think it's a really exciting place that we're in, where this is just going to improve things more and more, I think, as we go forward as well. So, thank you for sort of, sharing your knowledge around immersive technologies and the training and things like that. Mike, I think a lot of people can take a lot away from this.
Well, it was an absolute pleasure, and thank you for inviting me to join you. And excited to see how this all develops in the future.
Brilliant. So we're going to end on our usual what the health tech moment. So this is something we ask all of our guests to share at the end of each episode. So it can be a standout experience, something that's impacted you. It can be weird, wonderful, emotional, anything like that's kind of something that sort of has stayed in your memory from the world of healthcare. So, Mike, what's your what the health tech moment?
Well, the temptation coming, someone who works in technology every day, is to talk about, funny experiences of, training AI tools to, and what sort of unusual things have happened there, or around building digital twins. But I'm actually share a very personal one, because I think actually, although we're talking about technology, we should go back to what is the purpose of it. And it's really to help patient outcomes and to have better personal care. And mine was when my first child was born. We just had the most incredible experience at St. George's Hospital. He arrived a month early. We had no family around us. You can hear from my accent, I'm not naturally from the UK. And we went in there, and Diane, who was our midwife, was just incredible. And we had a water birth, and just the most tender personal experience, where although, Diane as a midwife was delivering literally thousands of babies you just felt that moment was so special and for you. And that's what healthcare does so incredibly well. And if we can enable people to do that, and the only advice I'd also give to anybody who's considering a water birth is, at no stage do they tell you that you might be kneeling on a very hard tiled floor for about 4 hours. And you as the father at no time can be saying, actually, by the way, my knees are hurting a little bit here. Could I have a cushion? You're literally sort of frozen at the end. So that would be to my one advice to anybody who's having that is make sure you tuck your cushion under your arm when you go in for that water birth. But I can only have praise for the NHS and what the healthcare professionals do day in and day out. For us, it's easy. We're working on technology that's predictable, that's binary, that we can think. But those people in the who are caring for individuals every day do an incredible job. So thank you.
And that is why we love asking